Andrew, almost everyone has a bottle somewhere. Daily multivitamin, gummies, prenatal leftovers, 50 plus formula. Is the honest answer that it helps a little, does nothing, or depends completely on who is taking it? Because the public conversation swings between magic shield and total waste.
It depends, but not in a slippery way. A multivitamin can be reasonable nutrition insurance when someone's usual pattern leaves small gaps. Low variety, little dairy, few animal foods, low calorie intake, older age, or pregnancy planning. But that is different from saying a multivitamin prevents heart attacks, cancer, dementia, or early death. The strongest responsible framing is modest. It may move inadequate intake closer to recommended intake, while the rest of health still comes from food, sleep, movement, and medical care. Think of the body less like an empty gas tank and more like a set of enzyme systems. Many vitamins act as cofactors. They help enzymes run. If the cofactor is missing, performance can suffer in blood formation, nerve function, immunity, or energy metabolism. If the cofactor is already adequate, adding more usually does not make the enzyme superhuman. That is why deficiency correction can look dramatic, while extra dosing in well-nourished people often looks unimpressive in trials.
So after someone swallows the tablet, are all those nutrients absorbed together? Or is a multivitamin more like a crowded bus where some passengers compete for seats? And does taking it with breakfast actually matter?
That crowded bus image is useful. B vitamins and vitamin C are water-soluble, so excess amounts are often excreted, though that does not make megadoses automatically harmless. Vitamins A, D, E, and K are fat-soluble, so they are handled with fats, bile, and transport particles and can accumulate more readily. Minerals are another layer. Iron, calcium, zinc, magnesium, iodine, and selenium have useful roles, but absorption and safety depend heavily on dose, baseline need, and what else is being taken.
Who is the person where you would nod and say, yes, this is more likely to be useful than decorative? Is it mostly restricted diets, older adults, people dieting hard, or anyone who knows their week was basically coffee and takeout?
The cleanest examples are not glamorous. Someone eating very little variety, someone with low intake during weight loss, an older adult with reduced appetite, or someone planning pregnancy may have a better rationale. In a fertility treatment cohort of 2,370 couples, female multivitamin use was associated with higher live birth likelihood, while male multivitamin use was not. That does not prove causation because supplement users may differ in other ways. But it fits the broader idea that reproductive planning is a context where nutrient adequacy matters.
But if someone is pregnant, trying to get pregnant, or using old prenatal vitamins casually, should they treat that as a different category rather than just a stronger multivitamin? I am thinking about folate, iron, iodine, and vitamin A, where the right amount seems more specific than a random wellness habit.
Yes, prenatal decisions deserve their own lane. For the general adult buying a standard multivitamin, the bigger problem is marketing inflation. The U.S. Preventive Services Task Force has not endorsed routine vitamin, mineral, or multivitamin supplementation as a reliable strategy to prevent cardiovascular disease or cancer in the general population. That does not mean every tablet is useless. It means the prevention promise is much larger than the demonstrated effect, especially when people already meet most nutrient needs. Immune claims are similar, biologically plausible, sometimes measurable, but easy to overstate. Older adults can have inadequate micronutrient intake, and a 2026 meta-analysis reported small improvements in immune function measures with micronutrient supplementation. But immune biomarkers are not the same as guaranteed fewer infections. In Cosmos, a daily multivitamin did not significantly reduce COVID incidence among older adults, though there was a suggestive signal for lower symptomatic illness among adherent participants. So the honest phrase is support, not shield.
What about the very common promise that a multivitamin gives you energy or sharper thinking? If someone feels better after starting one, is that believable, or should we assume it is mostly placebo unless a deficiency was obvious?
It can be believable, but we should not leap to a universal brain claim. B vitamins participate in one-carbon metabolism, red blood cell production, and nervous system function, so a low-status person might feel a real change. But in healthy adults, high-dose B-complex trials are still asking basic questions about neural connectivity, metabolites, biomarkers, and safety. A 2026 protocol is measuring those outcomes with imaging and blood markers, which tells us the field is still testing mechanisms. Until results show consistent clinical benefits, sharper thinking claims remain hypothesis, not promise.
The label is where I get nervous. If someone eats fortified cereal, drinks a protein shake, takes vitamin D, and adds a multivitamin, how do they avoid accidentally turning a normal dose into a high dose? Do fortified foods count in the same total, or do people mentally ignore them because they are not pills?
Start with boring labels. I would usually prefer a standard multivitamin near daily values over a megadose formula, unless there is a clinician-directed reason. Look for whether it includes iron, because many adults do not need extra iron and some do. Notice iodine and selenium. Notice preformed vitamin A. And remember product quality. Dietary supplements are regulated differently from drugs, so labels matter, manufacturer transparency matters, and third-party testing can be useful. The goal is not to win the biggest percentage on the back of the bottle.
Who should pause and ask a clinician before treating this as harmless? People on medications, people with thyroid disease, kidney disease, cancer history, anemia concerns, or just anyone taking multiple supplements. I am especially wondering about iron, iodine, selenium, and vitamin A because those feel less forgiving than a tiny amount of vitamin C.
The outcome check is intentionally plain. If the reason is a dietary gap, the success measure is improved adequacy, not a dramatic sensation. If the reason is fatigue, hair loss, fertility, anemia, bone health, or immune problems, do not let a multivitamin become the whole explanation. Use food quality, protein, fiber, sleep, and movement as the foundation. Then a multivitamin can be a targeted backup, not the main character, and it should be easy to explain why you're taking it. My final rule is simple. Match the pill to a plausible gap, keep the dose boring, and do not stack high-risk nutrients casually. Be cautious with high-dose vitamin A, iron, iodine, selenium, and multi-mineral combinations unless there is a clear reason. If a label promises cancer prevention, heart protection, guaranteed immunity, or longevity, downgrade your trust. A multivitamin can fill small nutritional potholes. It should not be sold as the road itself.